And millions risk blindness in 4 billion drug standoff. Now, this is drugs that had been donated to the country for various counties, but because of the Ministry of Health not paying for some of the damages and some of the charges that are required, the drugs are still held up and not cleared as yet. Michael Agwanda, very unfortunate, don't you think?
Quite unfortunate indeed. You look at a 4 billion drug donation, free of charge, given to this country. In other words, the Ministry of Health would have still have been required to import this drug whichever way because the country needs it. And trachoma, which is a bad disease, you know, from site to no site, and then somebody donates drugs for about 2 million Kenyans that requires this, and then the government cannot pay demurrage charges to clear this medicine from the port, from the port, from JKIA for that reason. But Michael, I want to say something here that will surprise people. Do you know why this will not be a very lucrative thing for the government to do? One is Ministry of Health has been riddled with about 4 billion corruption cases in the past. And two is because this is a donated money. It is not procured by the Kenyan who can get a back tip out of it or a 10% out of it. So it's not very lucrative for them. And thirdly, is that the only thing that Ministry of Health is required to do in this case is to be able to pay about 34 million to clear this by March this year. But you know, that is too little. They want more. And so they are waiting for these demurrage charges to go up so that they can negotiate with the clearing agent and say, look, it's now 70, let's give you 20 or 50, and then we can cash the rest. And so this is a game of ping pong. What they're trying to do here is to raise the stakes high so that they can have more money out of it. But you cannot understand anything else other than corruption in it by the government not being able to literally clear these drugs and release it to help the people. Remember, this was 2017 donation. There's 2018 that is awaiting. And the manufacturers are saying, look, if you cannot clear this, how do we even release about another 100 million plus that has been designated for the country? And
of course, they cannot be expected to pay. I mean, they've made a donation.
No, they've actually said they will not pay. They will not pay. And they've written to the president, and that's how the media now has caught up with it, because previously it was being dealt with the Ministry of Health, and nobody was releasing this information. Suddenly, now that it's been written to the president, then the media gets it, and you'll see these people acting. Because these are individuals in Ministry of Health that are hell-bent to corruption, and anything straight that can benefit this country is not to their interest.
All right, Ambrose Sweda, a very unfortunate incident here.
Assuming that it is true, this is what the Deputy President would call a movie. First, I think even the counties could have organized themselves and paid for this. What I think is happening is there are people, when you talk about the prevalence of the disease they're talking about, other people in the ministry do not, they see it as far. When you are taking something to Turkana or taking something to Mburu, they don't understand. They think, what are you talking about? Added the fact that there may not be chips in it, as my brother says, there may be very little chips or nothing. So somebody doesn't care. And then, because there will be no consequences, and there are no consequences, that is why we reach this. Otherwise, if somebody knew that the drugs would expire, then some people will be punished for it. There would be action. But you look at this and you say, it's very unfortunate.
And this is really paying the price of corruption, because if it is indeed true that the reason why, or one of the reasons why they have delayed, is because possibly somebody is not seeing any money that they can make out of it, then it leaves us as a very hostile people towards the people that need these medicines, because there are people that will go blind, yet would have saved their sight should this have been cleared. But simply because somebody may not have an opportunity to make money, they are stuck there. That would be very